Well, welcome everyone to the Canadian Cochrane Network and Center's Fall 2009 Research Webinar Series, a special webinar today by Dr. David Tovey. Welcome to everyone. Before we get started, I just want to take a moment to thank the funders of the Canadian Cochrane Network and Centre, those being the Canadian Institutes of Health Research and 6 of the research institutes, as well as to the Canadian Agency for Drugs and Technologies in Health for their collective sponsorship of us during this funding period. Thank you to CIHR and CADIF as well. I'd like to thank the WHO for providing the Illuminate webinar room to us. In particular, the Research Promotion and Development Division of the Pan American Health Organization. Thank you to PAHO, a valued partner of the Canadian Cochrane Network and Centre. I just want to briefly overview the format of the webinar. As for those of you who've joined us before, we very much work on a walkie-talkie system, so one audio activated at a time. When it's time for questions, and Dr. David Tovey will instruct you as to when he's ready to take questions from you, you can either raise your hand using the icon at the bottom left of the participant screen, as you can see in the top left of the webinar room, or should you be joining us without a microphone or wish to send it through the chat room, simply send us a chat. And I do remind you that if you do speak over the system, then once you are finished, to release your audio so Dr. Tovey can come back on to answer your question. And this is just a quick view of the participants window, so if you'd like to communicate with us during the session, you know how to. The bottom left is your hand icon. If you'd like to raise a question or to ask a question, you can raise your hand. There are the emoticons, so if you want to send a happy face, if you're confused or want more clarification on something, you can send us a confusion face. If you want to applaud Dr. Tovey, then the applause hand is there as well. Today we'll be doing some polling, and so the bottom right hand of your screen, you can see on the whiteboard, there's the check and the X. And as you can see on the screen that I have there, I have a choice of A through E. So depending on the question, the options might change. All you do for that is simply make your selection, and it won't appear in the participant window, but what you should see, whatever you have selected remains depressed. And then once we've allowed you a moment to cast your vote, then we will publish the polling results to the whiteboard. Okay, and we're going to do one quick sort of interactive feature with Illuminate before we get on with today's presentation. And so as you can see next to your whiteboard screen, there are a number of icons. One of them is a laser pointer, and somebody is already testing it out. Thank you very much. So all you simply do is select that item there, and I'm just going to bring up the next screen. So this is what I'd like you to participate in, and we are curious where you are joining us from. We might have folks outside of Canada as well, and if that is the case, then simply send through the chat room where you are joining from. So if you can select your laser pointer right now, and all of you can do that from where you are sitting. So click next to the whiteboard screen and then start indicating on the map. Great, look at that. So some folks in Ontario, BC, Alberta, into Quebec, thank you for joining us. And if there's anyone joining us from outside of Canada, please feel free to send us a message to the chat room and let us know where you're joining us from. Isn't that great? Wonderful. Well, thank you very much for joining us. And someone way in the north, well, isn't that great? Okay, also in the webinar room today we have Dr. Jeremy Grimshaw, and as you know, he is the director of the Canadian Cochrane Network and Centre, so I am going to hand the microphone over to him.
Thank you, Adrian, and welcome everybody. It's the first time I've seen the map light up with all the participants. It was great fun. As Adrian said, my name is Jeremy Grimshaw. I'm the director of the Canadian Cochrane Centre and and it's a great sort of pleasure for me today to introduce Dr. David Tovey, who is the editor-in-chief, the first editor-in-chief of the Cochrane Library. To give you a little bit of background of David, he trained as a general practitioner, a family practitioner in the UK, and worked in practice for 14 years before he joined the BMJ as the deputy editor and then editor of Clinical Evidence. He worked with the BMJ for 5 or 6 years, and by the time he left the BMJ to come to Cochrane, he was the editorial director of BMJ Knowledge. we were very excited that David accepted the position of Editor-in-Chief of the Cochrane Library in 2009, and really his appointment was one of the initiatives that Cochrane had to try and sort of make sure that we're developing the Cochrane Library so the content was of high quality, timely and relevant. And I can say to people on the call that David's already made a major contribution for those who are inside the collaboration, and is changing the way we're thinking about what we do and how we work. I think over the next 12 months or so, a number of the initiatives that David has started to move forward will become much more apparent in the Cochrane Library, in the Cochrane Library website, and also in the Cochrane Collaboration website. So we know inside the collaboration that David's been working hard and challenging us all to do better, and hopefully in the next 12 months you'll start to see some fruits of that. So I'm going to pass over to David just now, and I think he's got about 30-35 minutes to talk, and then we'll also have some opportunity for discussion at the end. So David, welcome.
Jeremy, thank you very much for that very generous welcome, and thank you to you all for joining us and for inviting me to talk during this visit. I hope that what I say will be interesting, but I would be very happy to take questions on any issue. What we've done is schedule some stopping points during the presentation and also, of course, at the end. I don't know. Yeah. So, if we move on to the next slide, which I'll do. So, fighting over the pointer here. So the structure of the talk, I'm going to talk a little bit about where I think we are now with Cochrane, a little bit about vision, where we're going from here, something about challenges and opportunities, and lastly, what do we need to be doing right now. So the first thing to say is that Cochrane is a fantastic success story. The idea that you have 18,000 active and willing volunteers, and everywhere I've gone in the last 9-10 months, I've met people who are not only incredibly skilled and expert in their subjects, but also amazingly committed to the task. We have a website that gets over 1 million hits per month, and when we last had an issue, in issue 4, 2009, we had over 1,000 recorded media hits. We provide over 4,000 systematic reviews, having hit that barrier on the last issue, but of course we also provide access to summaries of thousands more. So this is a considerable achievement. Oops. So Cochrane reaches out across the world, and on this slide you can see the areas in red where we have a national license, so people can access the library with just one click. The areas in green aren't areas where nobody receives access to the Cochrane Library, but in those areas you access it via an institutional license. And in the blue areas we have individual situations such as the state of Wyoming and in South Africa where they have particular arrangements. So about half the world's health professionals have one-click access to the Cochrane Library, and you can see the list of national licenses on the left-hand side of that slide. And here we have some numbers. One of the ways that that success is measured in journals is impact factor, and we have a very respectable impact factor of 5.182, up from 4.6 from last year. And so we presently rate 12th amongst the general medical journals, up from 14th last year. And here's a list of visits by country. As you can see on this list, the United States come out on top, with the United Kingdom, Australia, Canada just behind. If we look across the world, there's a search of the Cochrane Library every 2 seconds. A Cochrane abstract is viewed every 3 seconds, and a full text article downloaded every 4 seconds. And now looking at usage across these territories, you can see that the usage is in fact increasing in all these territories over the years between 2006, which are the blue bars, to 2008, which are the green ones. And you can see in this that the UK comes out with the highest usage, because this is looking at full text download, which I assume reflects the fact that we have a national license in the UK and not in the US. And if we look at Canada, here we have a graph over 2 years. The blue line is 2008, and the reddy-brown one is 2009. As you can see, a very dramatic increase in full text access since August. And here's some statistics to demonstrate that. In 2008, there were 54,000 people having an access denied message, which of course with your one-click access now should now be 0. And this has meant that between January and October 2008 and the corresponding period in 2009, there's a 27% increase in full text downloads. That's 42,000. So if we look at what are the reviews that people are most looking at, there's some quite interesting findings. If we look at the worldwide numbers first, you can see quite a substantial range of different areas. And one thing you might notice is some of these reviews, Cranberries perhaps, St John's Wort, are not necessarily the reviews you'd expect perhaps policymakers or health professionals to be looking at, which just shows the range of people that are using the Cochrane Library. But a real range of topics. Now if we look at Canada, I suppose the first thing one notices is that there's much more clinical slant perhaps to this, perhaps indicating more health professionals, and something of a sort of concentration around respiratory medicine, which would be interesting to explore at some point. So the one thing that I've learned over the last 11 months is that Cochrane is nothing if not ambitious. We certainly aren't sitting on the railway line reading the newspaper waiting for the train to hit. Everywhere I've gone, I've met people who really want to improve the reviews, improve the quality of the content, and reaching out to people, and particularly to end users. There are a number of challenges ahead, but the main thing that we have to concentrate on is making our product as good as it can be for the end user, really delivering a product that's based around the needs of the end user. And so what is our vision? I suppose our vision is to answer the questions that people have, to ask the questions that our end users have, and we'll talk about the different types of end user in a bit. But our ambition is to provide the answers to guide rational healthcare and policy decisions. So the right answer to the right question delivered in the most appropriate way. And if we could look at our users, they're very varied. We always think of them classically as consumers or patients or carers, health professionals, policymakers, perhaps guideline writers. I'm trying to represent the different groups and their different circumstances and environments on this slide. And if we look at those groups and think about the various features of the reviews, this slide is really just to demonstrate that these different groups may have different priorities. We can argue about whether there should be 1 dot or 3 in any particular box. But if we think about the different groups, they will have different priorities, and that covers both the content and the way that that's delivered. So if you're a visiting nurse, then delivery on a mobile may be very important to you. If you're sitting in a ministry with a desktop computer, that may be less important, for example. So let's think of an example, and here's a middle-aged couple, and if we think about what would be their needs for knowledge. If we think about them, they may have a chronic illness, they may have multimorbidity, they'll certainly have family or friends who have illnesses. What are their needs really? They may never have heard of Cochrane. So the first thing perhaps is to look on the bottom right hand of this slide and see that what they need is the content to be delivered to them. They don't necessarily want to go and look at it. In this current Web 2.0 world, people would expect things to be filtered through to them. So first we need delivery, making sure people can find the material or that it's given to them, as it were, on a plate. We've talked about the different situations where they may be looking up information, and so it's likely they're going to want pretty broad coverage. They may want chronic illness management about diabetes or hypertension or high cholesterol, but they may also have family, so they may want to know about childhood illnesses or immunizations. So it's going to be broad, but the most important thing is it's going to need to be understandable. It will need to be concise but sufficient. So if people have had a chronic illness for 3 or 4 years, it's very likely that they know the basics around their condition. So just taking the surface off isn't going to be useful to them. So we need to make sure that there's the superficial information for people coming to something new and the explanatory material that they can understand, but we may also need to answer quite detailed questions. It needs to be relevant to their needs, and they need to be able to believe it. And once they've understood what's being said to them, they need to be able to work to action it. They need to know what that means for them. And finally, they may want to share it. So they may want to print a summary off and show it to friends, or put it up on Twitter, or any number of other ways that they may want to share the knowledge that they've found. Oh, that was an interesting new slide. We'll get on to the end. I pressed the wrong button.
Oh, okay.
All right. Okay, so we can have a sort of.
You can flip.
Go on. I'll let you do that. While we're changing slides rather slowly, does anybody have any questions they'd like to ask at this point? You can't see anybody as yet. Right, okay, so on this slide, I do apologise, that was entirely my finger slipping. Here we have a plain language summary, because what this slide is really trying to show is that Cochrane is already doing quite a lot at communicating messages to consumers in a way that they can understand. So if you look at the features that I identified on the previous slide, here we have broad coverage, we have 4,000 reviews. If you read this plain language summary, you'll find that it's quite understandable, concise but sufficient. This is all there is. It's relevant if you're looking after somebody or you have rheumatoid arthritis, and you could use it to make to inform a decision. So plain language summaries are a clearly important step in communicating information to consumers, but we know that as we develop, that we may need to develop these further and make them even more useful. So in the next section, I'm going to concentrate on 3 elements of all this. Firstly, something that may be important to a lot of you on the call, how you create and construct the systematic reviews. Secondly, what's the content? How do we develop the content? And thirdly, how do we deliver it? So on this slide we have a Cochrane Review author. Now Cochrane is a large, complex international organisation. So somebody coming to the collaboration new may well be quite isolated, may well need to have help, may need to want to know that she's part of a real virtual network. So there could be training online that she can access. There may be mentoring programs that she can use. There may be need to be a facility whereby she can ask questions and get answers. And she also will want the technology that comes with the collaboration to support her in doing the task, to help her make a more precise search, help her with critical appraisal tools, and also perhaps to provide some institutional memory. So where people have done certain tasks before, maybe that can be made available to her as she starts afresh. So one of the features that will be very important over the next year or so is the development of the Cochrane Registry of Studies, which aims to be an accumulation of all the current Cochrane Review Group specialist registers, but acts as source or central, and head towards a study-based register. And this could be a major resource for review groups and review authors in conducting and updating reviews. using more technology. Increasingly we have the opportunity, the possibility to use technology to facilitate the task. So in this instance, here's a standard report in PLOS science, PLOS neglected tropical disease, which has been semantically tagged so that when the reader presses a particular button, here you have various elements of the tagging. And you can see how that, used slightly differently from here, might help somebody in finding the important detail within a study report in order to help them do data extraction, for example. If I now move on to content, one of the things I think has been really important is to think about content as being multifaceted. It's not just about the validity, the internal validity of the review. We're also wanting to ensure that the content is relevant to the end users. So we're asking and answering the questions that people are really interested in. Content needs to be accessible, so people need to be able to access it, that's to say read the content, but they also need to be able to understand it. And it needs to be produced in a timely and efficient way, and also needs to be maintained and updated. So now with some trepidation we go to the first quizzy bit. And what I thought we might do is see how well we think we're doing on these 4 parameters. So for the first quiz, if people would like to press the A, B, C, D or E, how well do you think we do on the question of validity? You can cast your vote now. People are doing, that's excellent. I think we have, I don't know, if we slice range down, we have 8 or 9 votes, I think. I think we could display them. And what that shows is that of those of you who voted, I think unsurprisingly and quite correctly, most of you said that we're actually doing pretty well on the question of validity. So if we move to the next slide, there's a question of accessibility. I wonder if that would change your vote. Perhaps you could vote now. And again, you can see underneath the box with all the people in, there's the A, B, C, D, E. And I guess accessibility should have been broken down really. I think it in a sense does cover whether you can access it physically, and secondly whether you can understand it. And again, we can vote, and again people are scoring it very highly, which is really encouraging. So just before we become a bit obsessed with the technology, the third one, relevance. How well does Cochrane do for relevance? It'll be interesting to see your votes now. Okay. Again, we're doing pretty well. That's good to know. Perhaps not quite as many E's as last time, sort of people perhaps going for D on that one. And finally, timeliness. Well, a definite trend down the scale, but although C is still okay, but perhaps we find that a little bit more challenging than some of the other features. So I think there are these 4 elements that we perhaps need to make sure that we're concentrating on them all, and you're voting with some slight suggestion that maybe there are some features that we perhaps could do better on. So I wanted to talk a bit about different needs again, and talking about how people look at the content differently. And this person yawning is perhaps a doctor working in an emergency room. And we need to think about the knowledge that we provide. The first thing to say is that it goes beyond treatment decisions. So if you're a doctor or a nurse working in an emergency room, making the right diagnosis is really important. The second thing is that you've probably seen lots of people quite quickly. You need to be able to put the knowledge you have into action fairly promptly. You may need to consult it before or even during a consultation, so it needs to be short enough that you can access it and understand it. It needs to cover benefits and harms if you're talking about a treatment decision. The scope may need to be broad on some occasions, may need to be deep, but you need to be able to believe it It needs to be sufficiently up to date that it's credible, and obviously you need to be able to get into it without protracted logging in and that sort of thing. And we can now think about a policymaker sitting on a hill in the low middle income countries. Some of those needs are still there. You need to be able to believe it. They may have a slightly more interest in the methods, so they may want to see that the methods are transparently displayed. They may want to look at particular features such as high impact or high spend conditions. And they may want other features in the review. They may want economic analysis. They may want a qualitative overview. So people in different circumstances having substantially different needs. I'm going to just stop for questions now, so if anybody has any questions, this would be a good time to ask. In particular, I'm interested in whether you agree with my assessment of where Cochrane is at the moment. Yeah.
Sorry, this is Jeremy just coming in. If you do have a question for David, please remember to raise your hand. And that's a little sort of blue hand button which is at the left-hand side just under the participants box. And you can either talk to us by audio or in the chat room. So please raise your hand if you have any questions for David at this time. If not, he'll continue and you'll still have a chance to ask him questions at the end. So we're going to give you another 10-15 seconds to raise your hand. We're all being very polite and Canadian today, so up. So we've got a comment coming through the chat room. We think it may take a second just to come through.
I don't know.
No, it's.
Yeah.
Okay, we have a couple of people trying to come through the chat room, and the technologist takes a second or two to come through. So we'll just pause. If anyone wants to sing a song while we're waiting for the chat room to come through, then you can put your hand up, and you certainly don't want me to sing, I can promise you that.
While we're just waiting for a moment, I just thought I'd offer a comment. I've been thinking about sort of what David's saying, and of course, as you know, I sort of wear the education and training hat at the center. So I think probably for the review author and the peer reviewer, sort of even having a sense, a bit more information in terms of the different audiences, and maybe that's something that that the Cochrane Training Working Group could sort of give some thought to as they're creating their curriculum, putting in those, user bits in terms of understanding your audience, maybe having some sort of, sort of food for thought that way. Just a quick comment, thanks.
Okay, I think the technology is challenging some of us, so what we'll do is we'll get David to continue, but as I said, we'll have more opportunity to ask questions of him later.
Okay, so the next section of the talk is really concentrating on development. So I've tried to say where I think that we've got to at the moment, and now I'm moving on. And the first part of this is talking about how we develop the content. And as many, perhaps all of you will know, one of the main features of development over the last 1 to 2 years has been the introduction of summary of findings tables, and I think it's really important for us to concentrate on this, because summary of findings tables are such a good way of communicating the information from reviews to end users, whether they be health professionals or consumers or policymakers, largely because they do concentrate on the outcomes that matter, and they can be linked to decisions about recommendations. So I think they're a really useful way of summarizing a lot of the vital information from a review. Similarly, I said in another slide that if you're a health professional or perhaps even a consumer, what's maybe important to you is not just how you're going to treat a condition, but how you're actually going to diagnose it. So it's really important that Cochrane is moving in to diagnosis and starting to create reviews of diagnostic test accuracy. And the third and fourth bullet point are a Canadian success story. In issue 4, 2009, we published our first overview of reviews. This on biologics in rheumatoid arthritis, and it also included the first multiple comparison meta-analyses, so looking at indirect comparisons of agents where there was only published research on those agents versus placebo. So again, this is really useful for health professionals and consumers to compare their options and inform health decision making. Another innovation in issue 4 was the development of the journal club. And because the biologics review we thought was so important both on clinical and methodological grounds, the first Cochrane Journal Club was on this review specifically. So on this slide we have the URLs for it. And I was going to ask the question of how many people had seen the journal club, and here you tick or you cross. Okay, so a small majority for, or not so small actually, for those people who haven't seen this. And I would encourage people to go and look. The first issue of the Journal Club has now been joined by a second on a completely different subject, this time melanoma. And I could just show you on the next slide what it looks like. As you can see, even the appearance is a bit of a departure from the standard Cochrane Library view. And what you get on the journal clubs are a summary of the review. I don't know if people can see my pointer moving around. No? I'll just... Yeah, so here you have a methodological summary. You can access parts of the review here. There will be a podcast, so an audio summary, just 3 or 4 minutes, usually recorded by the review author. And you can download slides, or you can view slides on the web. There's a little bit about an author profile. And if you can see further down the page, there's also free access to a number of related reviews. So what we're trying to do in this is to give people all the raw materials they will need in order to conduct a journal club. But it is also a very accessible way of learning about this particular review. Moving on to delivery, one of the things that I noticed that certainly came very heavily out of the strategic review was people's concerns that the way that the Cochrane Library is being presented to users had fallen behind the leading edge. And certainly Cochrane was one of the first publishers of digital content and online health content. And so I think what has happened is that somewhere on the line things have just fallen off the pace. And so a number of people, maybe a majority of people, were feeling that we really need to pay some attention to how we deliver the content to the users. And as a result of which we have developed with Wiley, our publishers, a program of projects aimed at improving the experience of users of our website. Firstly, to increase the publication frequency, so that from early next year we will be moving to a monthly publication cycle for the database of systematic reviews. And at the same time, we'll also be unveiling a new homepage and with a better navigation and improved search and browse facility, so people can find the content that they're looking for more efficiently and digest that material. We recognise that there's also some blurring in the different roles between Cochrane.org and Cochrane Library, and some user testing that was done in Oslo and Oxford had shown that people sometimes got a bit confused about where they actually were in the various sites. And so what we're going to try to do is to be much clearer about this, although the sites will still have very consistent labelling, but that the Cochrane Library becomes the source for the content, and Cochrane.org becomes the site where people can learn about the collaboration and access teaching material to help them do a systematic review, can find out about the collaboration's events and that sort of thing. And the final project will look specifically at Web 2 type interactivity, so that we can start pushing content to people on the basis of their known preferences and needs. And here's a picture of the first actual mock-up of the front page. So it won't look exactly like this, but I just wanted to highlight a number of features that I hope we'll see. Here we have the search and browse. This is always regarded as the main real estate of a website. So here a Google type search for the facility to advanced search. As you can see here, we're dividing the content by condition area, so people don't have to know specifically what review group might have published a certain topic. Hopefully this will be more intuitive. Down the right hand side, we're able to highlight specific reviews, either new reviews or reviews that we think are particularly topical or important. And on the far right hand side, you'll be able to see some ways of accessing different elements of content. And this is really about trying to make sure that we invite people into the site, we encourage people to sign up for content, sign up for emails, get training, learn about the collaboration. And the final box here with this slightly distasteful photograph attached, it allows us to put onto the homepage editorial type comments, so people may want to explain a new methodology or a particularly important review or their experience of working with a collaboration, and this gives them an opportunity to do that, and we will hopefully archive it so that people can come back to it in the future. If we're talking about delivery, we need to think about also different vehicles than just the website. We're looking at a pilot for an offering called Cochrane Clinical, which will aim to provide very concise summaries for clinicians that may be sitting underneath an electronic textbook, so that people who may want to know why drug A is a drug of choice in such and such a condition can click on the link and find a very concise, readable, digestible summary of a Cochrane review, which will explain what the effects of that intervention are. We're increasingly moving towards making Cochrane Library accessible on handhelds, and I think we'll increasingly move into decision support. Decision support being the top of Brian Haynes' 5S pyramid. That's knowledge that's embedded within electronic systems and health systems in order to help people filter the information on the basis of what's known about that patient. And that was a mock-up, which is slightly blurry on my screen, of what a Cochrane clinical, what we're calling these individual units, PAHOs, might look like. You can see here we're concentrating on the clinical question. Lots of use of hypertext so people can dive into the review to find the bit they want. But the concentration is on making this content short and punchy so people can really read it and understand it very quickly. And here we have the inevitable Cochrane presence on Twitter, and just really one thing to show here how we're advertising the Journal Club using Twitter, and the number of followers for the Cochrane Twitter is rising fairly rapidly, and is now sitting at just over 1,000. And as information gets smaller, we need to find ways of delivering the results of reviews to people on such things as mobile phones. And it may well be in some parts of the world, mobile phones are more ubiquitous than internet access. So being able to package content and chunk it up and send it to people on to needs may be a really important way of getting Cochrane content to people who need it. And there is, of course, the inevitable iPhone picture. This is just showing how Cochrane currently appears on an iPhone. And this is a project that we're just setting out, looking with some partners, both the Essential Evidence Plus and EBM Guidelines people, but also some software people looking at the possibility of creating decision support content based around Cochrane reviews. So what should we be doing now? My first one is deliberately slightly provocative. I wonder whether we need to think about creating fewer higher impact reviews. Everywhere I go, people tell us that we're working absolutely to capacity and we're really struggling to get the number of reviews that we need to get out. I think it's really important that we have a reputation for quality and that we make sure that all our reviews are really relevant. So maybe if each one is a gem, we could accept fewer in some circumstances. That's the thing that has to give. But really prioritizing about relevance. That doesn't just mean the priorities of one group or other, thinking about the different user groups and thinking what their priorities are. I think Cochrane really needs to reach out and engage with users. It's really important that we're not seen as somehow remote, and I know that the Cochrane Centre in Canada has been really excellent in the way that it's engaged with partners and professional groups. We need to improve the website, and we need to spread the word and really get people involved. We really need to work on updating. Over half our reviews are technically out of date, so we need strategies to catch up and to look at how we survey the literature to give us the triggers to know when we need to update reviews. And maybe we need to rethink what's fit for purpose. We have a one-size-fits-all policy at the moment, everything within 2 years. Maybe that's not appropriate. Maybe we need to be more flexible. And you'll be pleased, or maybe not so pleased, to know that the editor-in-chief and my unit are now responsible for updating. So we really have to make sure that things happen. So what's our approach in this? Well, we know there are lots of people doing great work on updating already, and what we need to do is build that and learn about it and understand it, and to make sure that that good practice is shared. We need to find out what the barriers and the motivations are for people around updating, and we need to work with some groups to really look at their problems in detail and see if we can make small or modest interventions that would make a difference. And I think in the period of 2010 we really need to come up with an action plan for the collaboration that will aim towards a target of all reviews being fit for purpose by the end of 2012. These are the sort of things that I can envisage that we might do. We may want to look at motivating factors for review authors, look at how things are prioritized, help review groups use the updating tool that's been developed from within the collaboration, perhaps also looking at peer review of search strategies, and looking at other elements of conducting the reviews that may be the obstacle to getting the reviews updated. So here are some new things I hope we'll also see in 2010. The rollout of the web program with a much improved web presence and more frequent publication. Cochrane Education that will build on the Journal Club and provide other ways of helping users to use the reviews to improve their learning. Improving our responsiveness to customers is a key recommendation of the strategic review. So it's really important that we develop this service whereby people come to us and say they really value a review on a particular subject, that we're able to respond to that. And finally, Cochrane PAHO, Cochrane Clinical, I've already talked about. So it's a really important time for health knowledge, and Cochrane is superbly well placed to provide the really important service to end users. And I think it's important to have just think about how we measure success. And I put up these 3 parameters which I think are particularly important: usage, quality, and participation. And perhaps we should be setting ourselves standards for the next year, the next 2 years, about how we improve our performance on all these while we're doing. So that was a run through. I'm now very happy to take some questions if you have any, or comments. Please do go ahead. Thank you.
Okay, we have our first question from PP. Could you ask your question?
Hi. No, I don't know. Do you hear me? Hello? Do you hear me? At Talkie-Walkie system, sorry, I forgot that. My question is, first, thank you for this great presentation. So if you hear me, that's great. Wonderful. I have a very specific question. I see in your presentation the tension between the production of research synthesis and then I would say the knowledge translation part. And I'm really happy to see all these developments in terms of knowledge translation. I mean, providing information to the users. I'm more interested in the Cochrane Clinicals. That's the first time I heard about that, and I'm very interested in that product. I'd like to know more about them, and when will they be available? First, for example, how many of them? What's the second? Third, what's the digital process? How will you manage to do that? And finally, did you plan to add anything that may be really helpful for the family physicians or the frontline primary care clinicians in terms of tables, homogeneous tables with stats easy to understand by the frontline clinicians, and tools that these clinicians may then use in turn with the patients? Sorry, I was too long.
Thank you for that question. We're at very early stages with this idea. It's only really been on our agenda for the last 6 or 7 weeks. We created our first PICO as a proof of concept, and then showed it to some people across the collaboration. And I have to say that I was really quite taken aback by the level of enthusiasm for it. People really wanted not only to support it, but also to contribute by creating these PICO summaries. So we are at an early stage. I think that, to be fair, we should, by, I would say, the end of May, have had some user testing on the first 5, 10 or 15 of these summaries. And we should have some feedback on what's useful and what's perhaps less useful, and whether there's some repetition, and whether we could do them somehow better. At that point, then we'll have a decision to make about whether we want to roll that out more widely, and what that would cost, and who would do the work. And all those things have yet to be determined. It is really important, I think, to take your point, that this meets the needs of the end users. So if we're providing summary findings tables, for example, or forest plots, the people who are not familiar with those should very easily be able to find information that helps them interpret them. At the moment, we envisage that these will sit underneath e-textbooks, so there won't be necessarily lots of explanatory text about this condition, or how common it is, or how you diagnose it, because that, we assume, would be in the electronic textbook. But the PICO sits underneath that, providing the evidence to support or contradict a particular assertion within the electronic textbook. So, as I said before, the textbook says this is the drug of choice, or these 4 are your alternatives, and somebody wants to say, okay, what's the evidence for that, and how would I choose between them? Then the Cochrane Review's summaries might give them the answer to those questions. So I'm sorry, that's a bit of a long answer, but I hope that's helpful.
Okay, any additional questions for David? Again, if you could raise your hand, and you could either respond with using the mic or the chat room. So Laurie Greco, we'll turn off our audio. If you can turn your
Hi, I think you can hear me. My question has to do with, we've recently conducted a literature review and found that a Cochrane review came up twice as 2 different citations, and we had trouble deciphering with the original publication date and the last assessed as current date, and the most recent publication date. Whether these were in fact 2 different reviews. I wondered if you could speak a little bit to any plans to address the noting of updates in Cochrane reviews. Thanks very much for this great presentation.
Okay, sorry, I just talked to myself. Thank you for that question. I think this is a really important issue, and Harriet McElhose, who's the senior editor working with me in the editorial unit, who had lots of experience on working in the infectious disease group in Liverpool, in the UK, has taken it on as one of her projects to make sure that we develop better systems for linking reviews and providing us a story for each review, so that we don't necessarily have a situation where you have a protocol, review, update. You may have a situation where a review gets changed, or a part of a review gets archived, and somebody wants to develop a new protocol to take on a sub-part of that review, or they may want to split the review entirely. And what we need is for the end users to easily be able to tell the story of that review and the various changes that have taken place. And I'm hopeful that over the next 12 months we will put some meat on the bones of this as a plan and discuss with our publishers how we and the IMS team how we can actually make it happen. But I think it would be a great service to users for them to be able to see the sort of history of that review. I hope that's what you meant.
David, any additional questions at this point in time? Anik earlier or asked whether David would be happy for his slides to be made available, and he's confirmed that that's the case, so we'll be sending these out very, very shortly. And we have a question from Chip in the hypertension group in BC, and his question was, what is being done to improve the feedback feature or section of Cochrane reviews? So, David?
Thank you for the question. I think that it's really a very important feature. When we looked at the handling of feedback, there was considerable variation across the review groups, and some management feedback that I think would be regarded these days as being suboptimal. I think when I actually now receive every piece of content feedback that is sent to us. And I think we're incredibly fortunate because it's very thoughtful, often very detailed content feedback from people, sometimes from within the collaboration, but sometimes outside. And certainly if I look back at the feedback that we received when I was at the BMJ, the quality of content that we're receiving at Cochrane is, I would say, far superior. And it's a real free good that we ought to be using. So I would like us to move to a situation where feedback is posted on the website, unless there are obvious reasons not to, either in full or in summarized form within a few days of receipt, if possible, certainly within a month, and that where possible the authors respond within 3 months. And I don't think either of those are absolutely unfeasible, and some of it can be automated. So it is a priority for us. It sits with a lot of other priorities, it's fair to say, but I'm hopeful, having talked to the IMS team and talked to Wiley, and also to the convener of the Feedback Management Advisory Group, that we can move forward on this in the next 12 months. I do agree with you, or your implication is that this is important.
Great. We have just a few more minutes left, so I'm going to ask if there's any final questions or comments from anyone on the call. Okay, I'm going to assume that there's not. I guess one of the things as a closing remark that I would like to do is, first of all, thank David very much for both coming across to Canada. While he's been here, he's been meeting people in the centre, people at CHR, Public Health Agency of Canada, the various review groups, and we've been working him extremely hard as he's been here. But I hope also that the presentation has demonstrated, first of all, it was a very correct decision for the Cochrane collaboration to decide that we needed an editor-in-chief as someone who can help guide us in the next, the next stages of the life of the collaboration. Secondly, that David was obviously a very good and excellent appointment. He has really been able to grasp the complexity of the Cochrane collaboration very quickly, and build working relationships with all the key stakeholders in the collaboration. And finally, I hope that you've got a sense of some of the things that he's been working on, and I certainly feel confident that as we move forward and we see the sort of evolution of the Cochrane Library and the Cochrane Collaboration website in the next 2 to 3 years, it's going to really look a lot better, be a lot more responsive to the needs of diverse users, and there'll be a broader range of services and products that Cochrane can make available to the world. So I'd really just like to thank David once again for presenting here today on all of your behalf. I would like to thank you for joining us. We will be sending out copies of David's slides, so you'll have those as well. So many thanks for your participation today, and I think we're probably done. Any last words, Adrian?
Sure. So I am sending through Dr. Tovey's presentation right now, so you will have a dialog box pop up. It'll prompt you whether to save to your computer, so you can do that locally. The other thing I wouldn't mind you doing is giving us feedback on this platform, so I'm going to send an evaluation through. If you have any ideas for future sessions as well, we would love to hear from you. Again, thank you, Dr. Tovey, for coming and presenting to us. Thank you, Jeremy, for moderating the session, and thank you to all of you for joining. Have a wonderful day.